So these days, the most commonly used implants are Mentor and Motiva. Mentor is a large American company, so it's been widely used for a long time. They offer different types like Mentor Classic, Mentor Extra, and Mentor Boost. Motiva, on the other hand, is a much smaller company, but they got FDA approval last year, and since then, its usage has been steadily increasing. Lately, Motiva seems to be used a bit more. One of its strengths is the nano-texturing on the surface, which is a very fine texture. Thanks to this, there's a lower risk of capsular contracture, and studies have shown it causes less inflammation over time. But the downside is, it feels a bit firmer to the touch. Mentor Extra, by contrast, has a softer and more natural feel. However, since Mentor implants have a smooth surface, there's a slightly higher chance of rippling, and capsular contracture is also a bit more likely. That's why they're not usually recommended for patients with thin skin or those getting revision surgery. There are other brands like Urosilicone and Sebon, but honestly, there just isn't enough long-term data to really recommend them. Once an implant goes into your body, unless there's a specific issue, it's probably going to stay there for a very long time, maybe even for life. So if a product only has 5 or 6 years of follow-up data, it's hard to fully trust it. I personally recommend choosing implants that have been proven over at least 10 years.